This is a standard cataract surgery with phaco emulsification and posterior chamber intraocular lens, um, starting with a side port incision at about the 10 o'clock to 11 o'clock position. A small amount of lidocaine is injected to anesthetize the interior of the eye. Then the main incision, which is approximately 2.5 millimeters, is created temporally. Viscoelastic is inserted next, which is a coating to help protect the inside lining of the cornea. A anterior capsulotomy is performed using a capsulorhexis technique. The capsule is about the thickness of a grape skin, and it is gently pulled away in a circular fashion. Then hydrodissection of the lens nucleus and epinucleus is performed to loosen the lens from the capsular bag. Phacoemulsification is begun to dissect the nucleus. There are various techniques for doing this: divide and conquer, chop and flop. This is more of a chop technique being done here. All of the lens nucleus is removed from the capsular bag, being careful not to rupture the capsular bag. The epinucleus is likewise removed, which has a consistency of a hardness somewhere between the nucleus and the cortex. You can see that's being removed now from the capsular bag. Try to keep the power levels and flow levels at a minimum to avoid injury to the corneal endothelium. Once the denser part of the cataract is removed with phacoemulsification, irrigation aspiration is used to remove the softer cortex. The cortex is vacuumed from the capsular bag. As you're seeing here. Next, more viscoelastic is used to inflate the capsular bag for insertion of the posterior chamber intraocular lens. The lens is inserted through an injector. The haptics, which help center the lens in the capsular bag, have to be both located in the bag for proper centration. Once the intraocular lens is in place, the viscoelastic is removed with irrigation aspiration. Myostat is used to constrict the pupil. The wound is typically hydrated to make sure there is a good seal. It's checked for any leaks